Today we are discussing about peptic ulcer disease and disease that categories. Peptic ulcer disease refers to an ulcer or sore that develops in the lining of the stomach, duodenum, the first part of the small intestine, or occasionally the lower esophagus due to the corrosive action of gastric acid and pepsin. It is a common gastrointestinal disorder that can cause significant discomfort and complications if left untreated. Peptic ulcer is localized erosion or break in the mucosal lining of the stomach or duodenum that extends through the muscularis mucosa and occurs in areas exposed to gastric acid and pepsin. Types of peptic ulcers. First one is the gastric ulcer. Occurs in the stomach lining. Pain may worsen shortly after eating. Duodenal ulcers occurs in the duodenum. Most common type. Pain often improves after eating but returns a few hours later. Esophageal ulcer occurs in the lower esophagus, often associated with the gastroesophageal reflux disease GERD. Dietary management. Food should include fruits and vegetables. Fruits, banana, apple, pear, papaya, etc. And vegetables, carrot, pumpkin, cucumber, spinach. Whole grains such as oats, brown rice, whole wheat products. And protein sources should be fish, lean chicken, eggs, lentils, low fatty dairy products. Foods to avoid. Spicy foods. Many worsen the symptoms in some individuals. Highly acidic foods, excessive citrus fruits, vinegar, rich foods. Irritants, coffee. If symptomatically irritant means if after coffee the patient's symptoms are aggressing means they have to stop coffee and excessive tea. Carbonated beverages and fried and fatty foods can delay the gastric emptying and aggravates the symptom. General dietary advice. Eat small, frequent meals and avoid overeating. Do not skip meals. Avoid lying down immediately after eating. Maintain adequate hydration. And prevention. Treat Helicobacter pylori infection when detected. Avoid smoking and excessive alcohol. Follow the healthy dietary habits and seek medical attention for persistent gastric symptoms. Peptic ulcer disease is a common gastrointestinal disorder resulting from an imbalance between protective mechanism and damaging factors such as gastric acid, Helicobacter pylori infection, and NSAID use. The hallmark symptoms is burning, epigastric pain, often related to meals. Early diagnosis, appropriate treatment, lifestyle modification, and dietary management are essential for healing ulcers, preventing complications, and improving quality of life. Prompt evaluation of especially important when the alarm symptoms such as bleeding, weight loss, and or persistent vomiting are present. Recommended diet is soft, balanced diet. Milk and curd, boiled vegetables, banana and rice, frequent small meals, and they should avoid spicy food, pickles, coffee and alcohol, smoking, very hot foods.